there has been testimony that anytime someone is having alcohol withdrawal, they need an immediate hospitalization.
Well, that's not true. I send a good number of patients home from the emergency department who present in mild alcohol withdrawal. If they're alert and ambulatory and can tolerate PO fluids, I'll give them Ativan in the ER, observe them for a period of time, and many of them can be discharged home on an Ativan taper to follow with their primary care doctor.
Does being in a jail setting and an infirmary setting give someone a different set of circumstances to work with?
Well, when you have an infirmary setting, you can do a lot more than if you're just in an office. So in the jails that I've worked in that do not have an infirmary, it's more difficult to manage some types of things at the jail. But an infirmary allows you to supervise a patient 24 hours a day. It's not the intensity or level of service you have in the hospital, but it's above an office setting quite a bit. So in the jails, we can do detox in an infirmary setting with very good results.
Do all county jails have infirmaries?
No.
Why did Dr. Hendricks, based on your review of the record, order Dilantin?
Well, there was a question of whether the patient may have had a seizure earlier that day. And so patients who are alcoholic can have a seizure based on alcohol withdrawal, but many of them also have a history of head trauma. There's falling down in the bed or in a car accident or what have you. And trauma to the brain, as it heals, forms basically scar tissue, and that can be a focus for seizure. So you can have a patient who is at risk for both alcohol withdrawal seizures, but also has an underlying scar in the brain as a focus for non-alcohol withdrawal seizures.
Was it appropriate and in accordance with the standard of care for Dr. Hendricks to order Dilantin?
Yes, I think it was an extra cautious step.
Did the ordering or administration of Dilantin in any form or fashion cause or contribute to any harm to Mr. Graham's liver, in your opinion?
No.
Was the ordering of IVs appropriate by Dr. Hendricks?
Yes.
Do nurses document IV orders?
They document the infusion administration of the IVs, that's correct.
You've been given a lot of information over the years, as I understand it, yes?
Yes.
I'm going to show you what I've had marked as Defendant's Exhibit 8. Do you know what Defendant's Exhibit 8 is?
Can't quite read the label at the top, but this is basically a nursing information sheet, probably a shift change to transmit information from one shift to the next.
What's the date?
5/19/6.
From what to what?
This shift was 6 a.m. to 6 p.m.
Is Mr. Graham's name listed on there?
Yes, down close to the bottom is Graham Justin.
Does it reflect that he was detoxing from alcohol issues?
Yes.
Does it reflect that he was receiving IV fluids?
Yes, under the treatment category, it notes IV fluids.
Now, thank you. After Dr. Hendricks's initial evaluation, one of the things he did was order labs.
Yes.
What was the first set of labs that he ordered?
He ordered a CDC, a CMP, and a INR.
What are those?
So the CDC is a complete blood count It tells you whether or not the patient is anemic. It tells you the white blood cell count, which can sometimes be a marker of infection. And it tells you the platelet count, which is part of the clotting system.
Do you see that?
No,
You need to see it?
probably.
Okay.
Should I come around?
Perhaps. Is this a chart that you prepared
Yes.
that I had blown up?